And then I think join us. So thank you so much for joining us today. My name is Emmy Betts. I'm the Deputy Director of the Injury and Violence Prevention Center, which is a collaborative initiative of the Colorado School of Public Health and the University of Colorado School of Medicine. Thank you for joining us today for part of our regular webinar series, Research to Practice. I'm going to briefly introduce our speakers for today and then turn it over to them. And we're really looking forward to hopefully an interesting discussion about car seat data. So specifically, the National Digital Car Seat Check Form is an electronic data collection tool that has collected data from more than 100,000 seat checks. Since its launch in 2018, child passenger safety programs have benefited from the free, clean data files, customized data dashboards, and interactive table tool to analyze car seat use and misuse data. And our presenters today are going to talk about this incredible data system and how we as researchers and practitioners might be able to access it. So our presenters will each introduce themselves as they speak. So first, in no particular order, I should say, we have Amy Artuso, Adele Polson, and Elizabeth Petraglia. Before I turn it over to them, a few logistics. So first off, we will be recording today. In fact, we are recording already. This will go up on our YouTube channel, and we will send the link to participants in case they want to look back at it. We will have time at the end for questions, so please use the chat for any questions that you might have, and we'll hopefully have a discussion at the end. And then please mark your calendars. Our next webinar will be Tuesday, April 25th at noon Mountain Time, 2 p.m. Eastern. The April webinar is titled The Intersection of COVID, Race and Ethnicity, and Sexual Assault, and will feature a panel including our forensic nurse expert, Christine Foot-Lucero, who leads the program at University of Colorado Health, along with a community-based advocate and a law enforcement representative. But for today, back to car seats, and I'm excited now to turn it over to our guest presenters. I think Amy Artuso is going first, if that's right. So I will turn it over to her, and we'll let her get her slides up.
Thank you. Oh, it says I cannot share yet. I think you have to, yeah, there we go. Thanks for bearing with me. Let's see if we can get this. Yeah, everything's stuck. Well, hello, and thank you for having us. We appreciate the opportunity to speak with you today. I'm Amy Artuso, and I lead the Mobility Safety Impact Programs in the roadway practice area with the National Safety Council, also known as NSC. There we go. Okay. I've had the privilege of working with the National Digital Car Seat Check Form, or NDCF, since the start of the program. So today I'm going to talk with you about how this resource or new public health innovation came to be, along with a brief description about the current NDCF offerings. Then Adele Polson and Dr. Elizabeth Petraglia will share information about NDCF data and outcomes. Before I talk about the National Digital Car Seat Check Form, I'd like to briefly give you information about the field of child passenger safety to provide some context. I'm a third-year Doctor of Public Health, or DRPH student, and I know in my cohort, I'm an outlier focusing on injury prevention, particularly in child passenger safety. Bear with me as I share my slides or change my slides. Thank you. So I want to make sure attendees today are aware that motor vehicles are a leading cause of unintentional injuries and fatalities in the U.S. Motor vehicle crashes are the leading cause of unintentional deaths for ages 4 to 21, which you see this yellow line right here. Yellow is for motor vehicles. And they're the second leading cause for children birth through age 4, and then again for ages 22 to 67. And this is according to data from NSC Injury Facts. Data also shows that when used correctly, car seats, booster seats, and seatbelts are effective in preventing injuries and fatalities for vehicle occupants in the event of a crash. In fact, the National Highway Traffic Safety Administration, or NHTSA, continues to reference car seats, booster seats, and seat belts as the primary line of defense to protect vehicle occupants during a crash, even with many new emerging vehicle technologies. To help families use car seats correctly, there are currently more than 37,000 US certified child passenger safety technicians. A standardized curriculum to train child passenger safety technicians first launched in the US in 1998. Advocacy for motor vehicle occupant protection began long before that, but 1998 is when the standardized national certification training began in the US. This was the result of different child passenger safety curricula being developed in different parts of the country, and NHTSA recognized that one national standardized training program was needed. In the process of working with families to conduct car seat checks or inspections, technicians are taught to document car seat assessments on a checklist or a check form. And that brings me to the NDCF. In 2016, I was attending the Kids in Motion Child Passenger Safety Conference, and a child passenger safety technician by the name of Randy Chabra was presenting on a digital check form he and his local child passenger safety program had developed in Texas. We were aware of other child passenger safety programs that were starting to do the same, and in listening to the audience at this conference session, there was a clear interest in using a digital check form among the technicians that were present. So some technicians had been in touch with Randy prior to the conference and shared that their programs were also trying to develop a digital check form. And to me, this seems similar to the evolution that took place across the country that led to the development of the National Standardized Training Program. And it seemed like the right time to propose a national standardized electronic check form. So during the Q&A portion of that conference session, listening to the primary technician audience, I heard two themes regarding barriers for technicians in developing a digital check form. First was the cost of developing a check form, and second was the cost of maintaining it. Fortunately, I was able to propose the idea of developing a national electronic car seat check form at NSC. And fortunately, NSC had funding from NHTSA that was subsequently approved for use to initiate this effort. While I wish I could tell you that this was that funding piece was strategically planned, I have to admit that opportunities kind of fell into place for that, which for me validates that it was the right time for this initiative. Attempts to create an electronic check form for child passenger safety had been discussed in the past, but never came to fruition. And I'm so grateful for NHTSA's support, as I believe having their support for the NDCF has been a key to the program's success. So in January of 2017, the first meeting was held with representatives from NSC, NHTSA, and Safe Kids Worldwide. In case you aren't aware, Safe Kids Worldwide is the national certifying body for child passenger safety technicians. The National Technician Certification Training is a NHTSA training that NSC manages through the National Child Passenger Safety Board. So these three organizations work together similar to a three-legged stool model and collaboratively lead the National Child Passenger Safety Program in the US. In addition to communication among these three lead organizations, NSC convened a committee of technicians that represented different child passenger safety program styles and different geographic areas throughout the US. As a public health audience, I expect you can appreciate that when developing a program, it's important to focus on how to segment your primary audience. In developing a national program, this is a challenge as one size usually does not fit all. And to add to the complexity, child passenger safety, or CPS, is considered a patchwork system in the US, meaning all states and territories operate their CPS programs differently. There are different child passenger safety laws in each state. And while vehicle and car seat manufacturers all have to meet the same federal motor vehicle safety standards, they each meet those requirements in their own way. So correct use of a car seat is like putting together a puzzle, because every child, every car seat, and every vehicle are different. And when you consider progress in injury prevention efforts, there are always new parents and families to educate as babies are born every day, or as some like to say, new parents are born every day. So to discuss and decide on information included on the initial National Digital Car Seat Check Form, we use primary audience participation, in this case meaning a diverse group of child passenger safety technicians to guide development, and we continue to update the program based on field feedback. And that is what you can see on the right side of the screen. The NDCF has a built-in feedback channel to receive ongoing suggestions from NDCF users. And while we're unable to meet all of the unique needs of every child passenger safety program, we have been successful in eliminating those two initial barriers, so technicians and programs do not need to worry about the financial cost of developing a digital check form or the cost of maintaining it. The NDCF is a resource available to all currently certified CPS technicians at no financial cost to create an account or access their check form data. Let me share some other features of the NDCF. In trying to meet as many program and geographic needs as possible with limited funding, the NDCF offers a web-based check form, a traditional paper check form, and an app that is available in Apple, Android, and Amazon devices. The app can be used even when Wi-Fi isn't available, which is a measure that supports equity. And all three versions mirror one another. So regardless of which version is used, the questions and sequence of questions are all the same. There's also a tiered data access system, meaning each technician has access to the check forms they enter into the system. This is beneficial because even if a technician changes agencies, they maintain access to the check forms that document the car seats they have checked and entered into the NDCF. Next, if a technician chooses to associate with an agency or program, there are agency accounts that compile check form information or data from all of the technicians associated with that program. This helps ease reporting burdens as data is easily accessed, and the data helps support program justifications, funding applications, and more. Next, state child passenger safety coordinators and Indian Health Service or IHS regional coordinators have access to the check form data entered in their state, territory, or region. This information can help support health equity to identify where there are location gaps in child passenger safety resources, among other benefits to the data. There is a public national data dashboard that anyone can access. And as I shared earlier, Adele and Elizabeth will talk more about the data and outcomes. The NDCF program also provides product-specific data to car seat and vehicle manufacturers, which means each manufacturer only receives data regarding their products, some of which have begun using the data to inform product engineering and design. This is helpful and I think very exciting because if trends and patterns in common car seat, booster seat, and seatbelt misuses can be identified and then addressed in product design, the possibility exists to organically reduce field misuse and includes the potential to reduce motor vehicle injuries and fatalities. The NDCF is a new innovation for the field of child passenger safety, so dissemination and implementation science applies. I like to reference the diffusion of innovations theory, and I'm thrilled to share that I believe we are currently crossing the chasm with NDCF adoption and regular use among CPS technicians and programs. Early on, we had innovators among technicians that were eager to begin using the NDCF immediately. Then we had early adopters. And as we cross the chasm of the adoption curve, I believe we're now transitioning to the early majority phase, which again is very exciting to me. The NDCF was definitely a social disruptor, but as word of mouth has spread about how easily technicians and CPS programs can pull their data from the system compared to manually tallying information from traditional paper check forms, the number of NDCF users is growing at a steady pace. In addition, I soon plan to start research based on behavior change theory and the health belief model to better understand barriers and motivators influencing technician decision-making regarding use of the NDCF. And I look forward to sharing those research outcomes when they become available. So I mentioned earlier that we received initial funding from NHTSA, and I'd like to take a moment to share that this program has really developed through relatively small incremental funding, which has influenced prioritizing next steps in development and evaluation. In August 2018, the NDCF launched publicly, and I'm excited to share that the public national data dashboard shows more than 111,000 check forms have been entered into the NDCF. Almost 10,000 of those car seat checks have been conducted virtually, which was a pivot the child passenger safety field increased during the COVID-19 pandemic. There are now more than 8,000 NDCF user accounts covering all 50 states, US territories, and Indian Health Service regions. And I want to take this opportunity to thank child passenger safety technicians using the NDCF and providing feedback, because without technician use, there would be no data in the NDCF. And I also want to thank the program partners and sponsors. NSC manages the NDCF program and has also provided funding support. As I mentioned, initial funding came from NHTSA, who continues to support this program. And again, I believe NHTSA's involvement and backing of the NDCF has been a key component influencing uptake of this new resource among the child passenger safety field. AAA Northern California, Nevada, and Utah, also known as the Mountain West Group, joined as a program funder, which led to the data analysis options we have today. And I think the data features are very cool, and I look forward to my colleagues sharing more information with you about the data in just a little bit. Tennessee Tech University iCube has developed the digital platform and continues to maintain the website, apps, and paper check form, as well as provides NDCF customer service. WestAT conducts the data analysis and creates clean data dashboards. And now the National Child Passenger Safety Board serves as the body of subject matter experts that make check form update decisions based on feedback from NDCF users, which are collected through a Redmine software system and reviewed by the primary NDCF program team. So we've transitioned from the initial planning and development committee of technicians, and each time an NDCF user submits feedback through the NDCF system, every feedback submission is reviewed by the NDCF program team. And when appropriate, the National CPS Board makes decisions about which changes should be implemented on the check form. Updates to the NDCF are made annually and released in October in line with the federal fiscal year. Gets me every time, sorry. Courtesy of NHTSA, the NDCF has a secure HIPAA compliant server, and personally identifiable information, or PII, is not collected in the electronic system. Each digital check form has a unique identifying number, and if a program needs or wants caregiver information beyond what is captured in the NDCF, they can create a form to be used locally for their particular program purposes. If they do create a form for local use, we encourage programs to record that unique NDCF check form number to correlate with their local check form information. Regarding the evolution of field use of the NDCF, Indiana was the first state to adopt statewide use of the NDCF in August of 2018. So you can see on this data visualization, the number of check forms entered for that state is greater than other areas. Indiana had a state digital check form before the national digital check form was developed, and coordinators in that state chose to transition to the NDCF in August of 2018. And another influence to positive trends in NDCF uptake nationally is the advocacy by local and state community champions. Presentations by a state representative from Indiana definitely influence decision-making in other states. and demonstrated the potential of NDCF program options in supporting child passenger safety efforts. Meeting the unique needs of all technicians and programs nationally continues to be a challenge, but the NDCF did eliminate those two initial barriers I mentioned earlier, being the cost to develop and the cost to maintain a digital check form. In addition, the National Standardized Check Form guides technicians through a consistent car seat check process, which aids in consistent data collection. The NDCF is available to all technicians currently certified through the U.S. certification program at no financial cost for an account or for clean data dashboards. And as more data is entered into the check form system, the data will help us address equity issues by mapping where community CPS resources are lacking and improve identification of trends and patterns in misuse. So to summarize some public health concepts that I've touched upon during my presentation, I mentioned primary audience participation in program development, qualitative theme identification when prioritizing program direction, dissemination and implementation science, particularly the diffusion of innovations theory. I briefly touched on behavior change theory, particularly the health belief model. I shared about the role of community champions and the success of new resource uptake, using data to support health equity, utilizing data to inform product engineering and design to improve safety, and strategic program development with incremental funding. I hope this information has been helpful. I'm happy to answer questions during the Q&A at the end of the presentation. Right now, I'd like to turn the presentation over to my colleagues from WestStat, who will share information about NDCF data and outcomes. Thank you very much.
Thank you, Amy. So I'm just going to now bring up my presentation. Bear with me for a moment. Okay. Is everybody seeing our slideshow? Perfect. So thank you very much for having us here today. We really appreciate the opportunity. I am Adele Polson. I am a senior study director at WestStat, and for the past about 24 years, I have been doing research on transportation and highway safety. I specialize in occupant protection. We do other projects for NHTSA, such as the National Occupant Protection Use Survey or the National Seatbelt Use Rates. We really love being a part of the NDCF team. I've been a technician since 2008, and I've always worked with data at WestStat, and I always thought the CPS field could really benefit from more data. So when I heard about the NDCF program in 2019, I begged and pleaded, and no, I approached Amy, and she was kind enough to listen, and we were able to join the program team, and we're very proud of this work. Joining me today is Dr. Elizabeth Petraglia. She is a senior statistician at WestStat, and I think she's been with us about 10 years. She also works on a lot of our NHTSA projects on national data sets and does all of the analysis for the NDCF. So I'm going to go ahead and jump into my presentation. Of course, we'd like to thank all of our colleagues who help us put together all of this data. That includes our colleagues at WestStat as well as the program team. As Amy mentioned, it's a very collaborative effort, and we wouldn't be able to present all of this today without the support of the AAA Mountain West Group, NSC, and of course, other statisticians at WestStat. So our goal today is to quickly review some of the background on the NDCF data, provide you with details on the coverage and context of NDCF data, and also review the results of an in-depth analysis. We just heard from Amy about how much work went into the initial development of the NDCF and also how carefully we consider front-end updates to the form and the interface. We need to be just as thoughtful about how we take all of the car seat checks and transform them into usable data. We set up a pipeline for efficiently performing data cleaning, data analysis, and then putting all of those results into a user-friendly data dashboards. This process has to be standardized and easily reproducible every month. In terms of data cleaning, it's important to remember that these data are not being collected by trained data collectors or as part of a study. That's definitely different for us at WestStat. The NDCF data reflect information that was historically collected for the reasons on the left-hand side of the screen, right? For the car seat check that's being performed primarily to educate parents and make sure the children are safe. And these forms typically are used just to document what's done at that seat check. Historically, paper forms were reviewed to manually pull out summary statistics. Just like Amy said, we've talked to a lot of different coalitions from around the United States, and a lot of them had paper forms, and then they would literally fill out tally sheets just about how many car seat checks they conducted and kind of get an idea of how many instances of misuse they were seeing. And when you're doing that, that human reviewer is able to look at the whole form, and if something isn't clear, be able to read all of the notes and upcode things and clean it up so that the overall counts are consistent. However, to run the analysis using statistical software packages and still get those right overall counts, we need to make sure all of the variables are coded correctly. So most of our data cleaning currently involves reorganizing the information. Technicians love to get extra detail. Like we said, over on that left-hand side, this form is used to document how they are working with these families. But we need to figure out how to get that all coded in a standardized way. So a great example of this is the growing popularity of the all-in-one type seats. And all-in-one is not a seat type category that we have in the NDCF because we really want to know how that seat is being used. Is it forward facing? Is it rear facing? Is it being used as a booster? So some technicians still enter the type of other and write in all-in-one. And then we have to review the text and review those text fields, those open fields, and figure out which type of NDCF seat it really is and code it that way. So all of the upfront work on the flow of the form has really minimized the amount of manual data cleaning, as have the excellent training materials available on the NDCF and Jennifer Bogue's presentations. And this slide is actually one that we show in presentations to technicians about balancing their dual roles. So we're trying to educate technicians about the importance of making sure all of their work is complete and accurate. And as the program expands and our analysis becomes more generalizable, we are counting on all the technicians to continue to provide us with quality data. Okay. So the data, once it's cleaned, we go ahead and undertake the analysis. Right now, we have all of the data cleaned through January 2023, and we have over 115,000 records in the data set at this point. We add somewhere between 4,000 and 6,000 records in an average month. We do tend to see more infants or prenatal checks in the NDCF compared to all the children riding in the cars. And the most common seat type, of course, is the rear facing only seat. Okay, there we go. Sorry. So we did take a careful look at Colorado. Elizabeth ran some analysis for you guys. And the NDCF also makes it easier to filter down to a specific state. Colorado has a higher proportion of checks that come from infants or unborn children and checks that involve rear-facing seats. So Colorado has 79% of its seats for infants or an unborn child compared to 60% nationally. 81% of our Colorado checks are of a rear-facing only seat compared to 50% nationally. The numbers from the previous slide are a high-level summary of what's going on with the data, but these files are fed into interactive data dashboards that display much more detailed statistics. These dashboards consolidate all of the results and feed them into various charts and graphs and maps. The display of the data, as opposed to tables with tons of numbers, consolidate multiple findings into a few summary outputs. The idea behind the dashboards are to display key findings in a more user-friendly format with the idea of making the data more useful to all of our users. They aim to make trends easier to identify and overall snapshots easier to understand. As Amy indicated, this is the first time technicians are getting this type of access to this detailed data. The dashboards follow that tiered access system that Amy described, with a national dashboard of all the checks that is accessible to all of our users, and actually everyone can visit the national dashboard. Technicians that have personally conducted checks have their own customized dashboard of just their checks, and state coordinators will have a dashboard of all the checks that occurred in their state. So now we'd like to show you some highlights of the dashboards. As I indicated, everyone can access our national dashboard by visiting the National Child Passenger Safety Board webpage. So I'm just going to give you the highlights right now, but you can check it out later in detail on your own. So here's our homepage. As you can see, it provides summary information, including the total number of seats checked and the % of overall misuse. The chart shows the number of seats by year and by seat type. Again, quickly looking, we can see that 2022 was an awesome year. We had a record-breaking year for the number of seats entered. We take a quick look at the menu bar. You can see that from here, we can access pages on misuse, maps depicting where all the seat checks are occurring, car seat information and vehicle information. And you can also access the table tool, which allows you to manipulate the data. Throughout the dashboard, if you'd like any additional information about any data in the chart, you just have to simply hover your mouse over that section of the chart and additional details will automatically pop up. So here I just moved my mouse over the rear facing only seats for 2022, and we can see we saw 20,293 rear facing only seats. We've also added some functionality to help create reports. So any of our charts or tables can easily be downloaded to Excel or as a PNG file. It's also really important to note, and I tell the technicians this all the time, you can't break the dashboard, so you can feel free to click around and try different things out. Here's part of the car seat misuse page. Again, this is just a glimpse. I strongly encourage you to go check out the national dashboard, but this depicts misuse by state. On this map, you can also select different types of misuse. So this map is currently depicting any misuse among all types of car seats. However, as you can see on that left-hand side, you can toggle between all checks, postnatal checks, and prenatal checks. And then across the top, you can select misuse rates across all of our different categories. This is a very detailed data collection form, so we can look at misuse by harness misuse, load leg misuse, lower anchor misuse, and so on. And there are even additional subcategories that pop up on the page once you select those. So it's very data rich with lots of interesting details. Elizabeth is now going to take over and show you some of the findings from the NDCF.
Yeah, thanks, Adele. So, 115,000 records sounds like all this awesome data. And it is exciting to have these data available. Like Amy and Adele kind of alluded to, there wasn't a lot of data in this space before the NDCF. But as responsible researchers, we also need to be careful about how we present the NDCF data. At its heart, it is administrative data. It's not a probability-based study. So it's wonderful to have all this information, but we also need to keep in mind that it has coverage limitations. And we also need to make sure that when, we hope more people are able to access and use the NDCF data, that people are looking at these dashboards we've put together, but we need to make sure that they present findings with the appropriate context. So this involves educating any data users about what we can and cannot conclude based on the NDCF. Next slide.
Sorry, I am trying. It's not happy with me. I'm not really sure what's going on here. Sorry. There we go.
Yeah, it knows you're not talking anymore.
Oh, okay. It's done. It's done advancing. Okay.
All right. So like I just mentioned, it is important to recognize that the NDCF does not evenly represent all children, car seats, or vehicles in the entire United States. So the NDCF will only accurately describe children that attend car seat checks. And like we kind of saw in those earlier numbers, it does heavily overrepresent infants in rear-facing car seats. Those, new parents or, parents to be who are coming in to get everything checked for the first time are who we tend to see in this, in the data set. So, and then, you kind of saw some maps earlier too. This is a more detailed look. Looking at the geographic coverage of the NDCF, we do have at least one check in every single state, but you can see that Indiana accounts for about 25% of the checks we have so far. Colorado, you guys are pretty well represented, which is great, but some states are very underrepresented according to their population. So even though California makes up about 12% of the US population, it only has like less than 5% of all of the checks in the NDCF. And we only have 61 NDCF records from the whole state of New Jersey. So there are definitely some coverage issues geographically. For the moment, we hope we'll work on those. So because we were kind of, curious about what this coverage meant, we did a basic comparison of basically how well does the NDCF actually represent all children in the United States. So we took the 2021 American Community Survey 5-year estimates and just compared, let's look at the counties that have NDCF data, and let's compare these to all counties in the United States. And we did these 2 different ways because I was curious about potential differences. So weighting counties by their populations so that, more populous counties had more influence on the final numbers, or also weighting the counties by the number of NDCF records. So counties with more NDCF checks kind of had more weight in the final numbers. And so again, these are very, very rough, high level comparisons, just looking at mapping car seat checks to counties and then comparing, overall population statistics. But hopefully this would kind of give us an idea of, are there any major red flags? Are there huge areas we were missing? Are there huge populations we were missing? Are there biases that we need to explicitly address at the beginning of, any presentation about NDCF data? Systematic underrepresentation of minorities, income groups, undercoverage of children, things like that. So, bottom line, we looked at a few things. And after doing this, we're not as concerned about the geographic coverage. I mean, obviously, we would like to get better geographic coverage, but the counties that we do have NDCF data in seem to be on average, at least reasonably like the whole US on the variables we looked at. So we're covering about 85% of the US population. So, the places we're missing, apart from New Jersey, apparently, seem to be pretty low density areas. There are some differences, but nothing that's super concerning. You see these numbers for proportion of children, both ways we look at it, we're covered, there's about 6% in these child age groups. So we seem to have good coverage of children that's consistent with national estimates. We're covering a little bit more of households with vehicles, which makes sense. And, median incomes, even when you're looking at kind of the record weighted version. So when we're weighting by the number of NDCF checks we have in certain counties, that race distribution looks similar to the whole US. So this is, again, we'd love to just get better coverage by getting more and more records, but there's no major red flags in our coverage right now. It also means that we have a good distribution of records where we could use more advanced modeling or some kind of weighting to reasonably, adjust our estimates to have national coverage. So this is all good news for me as a statistician. This gives me confidence that, especially as our data set continues to grow, we can do really cool things with these data and not have to worry about the fact, worry that we're missing entire chunks of the population that we can't adjust for or control for statistically. So next slide. But again, we're not quite there yet with national representatives. So we also compared to a survey that WestEd actually does that is national, which is the National Survey of the Use of Booster Seats. So this is a probability-based nationwide restraint use survey, and it produces the national estimate of child restraint use. So we collect data through observations and through interviews. So you actually, talk to parents and say, how old is your child? How much does your child weigh? Things like that, race, ethnicity, so self-reported race and ethnicity. And so you can get nationally representative, statistically valid estimates of restraint use by age, gender, and region. And so, of course, we are curious as to how close our NDCF estimates and our NSUBS estimates are. So next slide. So one basic thing that we can compare between the NDCF and the NSUBS data is child restraint use type on arrival by age category. So what kinds of car seats are children showing up in on arrival? So this isn't like a perfect correspondence, but the thought behind sort of looking at car seat type is that in general, more safety conscious parents are probably more likely to follow car seat type recommendations. So a more safety conscious parent would have their less than 1-year-old definitely in a rear facing only car seat. and follow that recommendation. Children ages 1 to 3 should generally also be in a rear-facing car seat. Children ages 4 through 7 are generally safest in a forward-facing car seat with a harness. So not, prematurely transition to a booster seat and not just wearing a seatbelt. So looking at this analysis, you can see the NDCF numbers on top, the NSUBS numbers on the bottom. And you can see that kind of as we suspected, the NDCF is probably covering those more safety conscious parents. So, for those less than 1-year-olds, we're seeing a high percentage of children in rear facing seats anyway, as is appropriate. But when you get to those older age ranges, you do see, those NSUBS numbers sort of go down. When you're looking at that 1 to 3 age group, we've got 56% of the children we see in the NDCF in a rear facing car seat, whereas only 17% of the NSUBS records are in that rear facing car seat. And same thing, you can see the same thing with the 4 to 7-year-olds. We've got 53% of those kids, still in a harnessed forward facing seat. For NSUBS, it's only 36%. So, again, we're seeing when we look at NDCF data, we have to keep in mind that even though, we're looking at misuses and things like that, these still are generally likely more safety conscious parents and caregivers that are coming in. So next slide. And so on the current national dashboard, we can see that our misuse rate that we're reporting through the NDCF is 64% for postnatal checks. So among all the car seat checks with children, not these unborn infants, 64% of these seats arrive at the seat check with at least one misuse. And there's a lot of technicians, a lot of users who say, hey, this is lower than other national estimates. This is lower than what maybe I'm seeing when I do car seat checks. And we understand that and we agree. And this is because the caregivers at car seat checks are more aware of safety resources in general. So for now, anyone looking at NDCF data, we're trying to spread the message widely. These misuse rates only apply to seats checked via the NDCF. So again, working towards more seat checks, more representative seat checks, but in the meantime, what can we responsibly estimate with these data? We recommend that it is most informative to look within the NDCF and compare between age or car seat type categories. So instead of saying this is an absolute national estimate of misuse, to say which seats are more or less likely to be misused, what are the most likely types of misuse, things like that. So comparing things within the NDCF data set, because we have reason to believe that all those relationships within the NDCF are still generally correct. Maybe just the rates are, lower. And also ask questions about the information you have, guiding users to say, how many seats have we checked? What types of seats are we seeing? What are the most common types of misuse? Those kinds of things kind of can't go wrong with. And so I'm going to go through these next few slides a little quickly so we have time for questions, but kind of showing what I mean about research questions that can be answered with NDCF data. So things like, what are the top misuses by restraint type? So this would be useful for, in theory, a technician, certain type of seat comes in, okay, what are the major things I need to look out for? So we looked at misuse rates within the different car seat type categories of the NDCF. And you can see that the number one misuse rates for the number one issue with some of these seats is being installed. So the number one misuse consistently involves some type of issue with properly using the seat belt for installing the car seat or securing the child. So they're having trouble, securing that car seat to the car. And you can see that with the lower anchors, it seems to be a little misuse is a little less likely. So in general, getting across the message that it may be easier to try and install with the lower anchors versus the seat belt. So next slide. And the NDCF is really cool because you can dig pretty far down into the data. So not only looking at, okay, what's overall misuse, what types of major misuse are we seeing, but really and then exactly why and how is it misused. So this slide is kind of really focusing in, if you're looking only at those rear facing, only those infant car seats, what are the most common types of misuse we see? And so you can see, okay, when you're looking at seats installed with the seat belt or with the lower anchor, when you're looking at harnesses across the board, the most common issue is that everything is just too loose. And then you'll see there's, we have a couple other kinds of misuse on there, but this is the level of detail you can get with the NDCF data. So next slide. And same thing, this is just in contrast with the rear facing only slide. You can look at forward facing, like a different kind of car seat, and say, okay, how are the patterns similar or different? What different features are being used correctly or misused? Again, we see sort of across the board, everything's too loose. You got to tighten it all up. But again, this is the level of detail that you can get through the NDCF data. And so next slide. Basically, the takeaway that we sort of want data users to have is that the NDCF is a unique, large, and constantly growing every month source of data on car seat misuse in the US. So we're hoping that it is used now and it will continue to be used by technicians, but also by public health researchers to help target resources and outreach. We're trying really hard to make sure that both the form and the backend data dashboards that we're producing are responsive to user needs and requests. But while you're using these data, it is important to interpret and use the NDCF data in context. You can't take our misuse rates and say, oh, this is, a probability-based national estimate. It is, a product of how the data were collected. So future work that we'd love to do somewhere down the road is, doing additional data cleaning. We've got this table tool we didn't even get into where users can kind of create custom reports and just make that all more user-friendly. Create a user's guide where someone can just download, kind of a full documentation about how to use the data. And like we said, continuing to expand usage and coverage. And the statistician in me really wants to be able to do some more complex analyses and modeling and weighting and things like that. But again, we'll get there. All right, so thank you for your time. And thank you all for listening. And I guess we're going to open it up for questions.
Thank you so much for that really interesting presentation about something I had no idea existed. I mean, to be fair, I don't mostly do transportation safety research, but what an incredible resource this is, albeit with the limitations that you mentioned. Does anyone have any questions? We'll open it up. And because we're a smaller group, I think if people want to unmute to ask their questions, that's all right as well, or you can put it in the chat.
I have several questions, but and I'm uncomfortable with silence, so I'll just jump in. And I think my first question, kind of going chronologically, is for Amy, and thinking about this move to virtual checks, and of course that makes so much sense for a lot of reasons. I can see the pros, but I can also imagine some cons, and just kind of curious what you think about kind of the benefits of that move. I mean, it was essential because of COVID, but curious if you see that continuing now that, to experience some of the benefits in terms of maybe reach and capacity, but also knowing that it would be a different experience, and just what you think about that, the virtual checks.
I think there is a study out of Massachusetts where, and there's just the one that I'm aware of, but they didn't see a difference in like the efficacy of the car seat checks when it was in person versus virtual. I can see in-person benefits. That's ideal, but I think, as you mentioned, with reach and capacity, Westat, are you the ones that did the convenience study? Because there was a study about how a lot of people don't know how close child passenger safety resources are to them locally, or may not even be aware that those services exist. And we know in child passenger safety as a whole, we have a long way to go. When you look at the number of car seats that are checked and the birth rate, the national birth rate, such a small percentage of car seats are even being checked by technicians. And so that's another area of exploring how can we improve that situation. And if it truly is a convenience barrier, I do think virtual car seats have the potential to help with that reach and engagement. And there's different techniques out there, or tools, I should say. University of Alabama has a virtual resource. They use Help Lightning technology where it's almost like the technician can reach in through the video conferencing screen and point to parts on the car seat. I wouldn't say most technicians have access to that, but that's an area for improvement if we are able to make that accessible to more technicians.
I have a question. What's going on with New Jersey? Why do you think the numbers are so low? Is it that they're not doing them or they're just not recording them?
So yeah, not everybody is using the NDCF program. We have different states that have engaged at different levels. Some of the state coordinators have just come out and said, everybody has to use the NDCF for all your car seat checks, end of discussion. Some of them have encouraged it. Some of them haven't gotten on the bandwagon yet. Jessica Butterfield, one of the other colleagues at NSC, kind of has this analogy of like jumping into the pool. So we have some people that have dipped their toes in, we have some that have cannonballed in, we have some that are still like outside the fence looking in and seeing if they want to come swimming. So yeah, some more outreach and more education.
Yeah, and to be fair, I didn't want to call out New Jersey specifically. There are other states. It was a good example of a state that is fairly dense in terms of population, but just had so few checks in the NDCF.
Yeah, no, I have lots of friends who live in New Jersey, but it is a really interesting, like the stark difference between.
Yeah.
Well, and another thing we would like to do, we were just discussing this in a separate NDCF meeting today, with a data committee for the National Child Passenger Safety Board. We would really also like to look at where do we have car seat technicians, where do we have car seat technician instructors, and where are we seeing car seat checks, and are there, is there a place where we have a bunch of instructors but no seat checks? So, do we have Jennifer Aboke, who does our outreach, do we have her go there and, start to find those folks and start to talk to them and introduce them to the NDCF? So those are all ideas we have for future analysis, like Elizabeth referenced. I want to keep adding and expanding.
Yeah, and related to that, I was wondering, I really appreciated your mention of dissemination, implementation, sort of thinking about spread. And the slides around sort of, for example, using the data to identify the most common mistakes, for example. Can you talk a little bit about how that data gets fed back to technicians? To actually, if you were going to use
Sure.
that for technicians to know what to look for, do you have a process right now?
Sure. So actually, just because of the time constraints, Elizabeth and I just cut out a bunch of slides out of the presentation yesterday, which was AAA Mountain West Group had engaged us to do that analysis. What are the common mistakes? What's the number one misuse, things like that. And then they actually engaged a marketing team to develop social media content and in English and in Spanish, and they made that available on the National Child Passenger Safety Board. So technicians could go there. We try to do this. There is a National Child Passenger Safety Week in September each year. So we try to update that data, refresh that campaign, and release it to technicians so that even just single technicians working on their own can post it all over their social media. Right, that's one of the ways. And then the other ways are obviously the dashboards. We hope that they look through the dashboard and they see the kinds of mistakes that are happening with the families they are working with, so that they can try to identify those.
And I think one of the things we'd like to move towards is more data literacy resources for technicians, because they're not trained data collectors. And I talked about the tiered access. So when a technician looks at their own data they have access to, they have it in CSV format that they can just download in real time. And it's about a 1 month to 2 month turnaround time for the clean data dashboards. And there's also the table tool feature that Elizabeth briefly mentioned. We have the tools there. I think part of our next steps has to be teaching technicians how to utilize that data to their benefit, especially their program benefit.
Mm-hmm. Yeah, like I said, they literally used to have tally sheets of just forward-facing seat, rear-facing seat. So when we show them this stuff, a lot of the audience is just like, whoa. Like, and we had a session at a conference like Stump Adele asked me a question to see if I can find it in our dashboard and in our table tool, and people weren't even quite sure what to ask. Do you know what I mean? So definitely put a lot of discussion into how are we going to do this? And so we do try to present at the national CPS conferences about the data and, show how to use the data, but what we would love to do more.
I have a quick question. I was just wondering if you have any or have heard any stories or examples of kind of like prevention efforts with any kind of program or organization that has utilized any of the findings from the dashboard data.
Ooh, that's a tough
Well, I
one.
think the AAA Mountain West group is the most active example. I think that's part of the learning curve right now with it. We just had a local champion in Michigan. He's a longtime child passenger safety technician instructor, but a new user to the NDCF. And they just sent an email out statewide to say, again, they don't want to hear it from us anymore. We've been talking about this since 2017. They need to hear it from their peers. And he's an influencer in the state of Michigan. And he's like, I just pulled up all this data in 3 minutes. Like, I can't believe it. And so it's like, this is the tip of the iceberg for what we're going to start doing in Michigan now. And Indiana, I think, is an excellent example. Unfortunately, they just had a change in personnel at the lead agency for their statewide child passenger safety program. But that representative from the highway safety office really, I wish I could remember in more detail how he applied to supporting the CPS programming, but he had it down to like a science. He knew when car seats were being distributed based on the data that he would just auto ship car seats to the programs. He had provided electronic devices to all of the technicians that were part of their program. He surveyed all of them, like, what kind of device are you more likely to use, Apple versus Android? And then based on the most popular answer, that's what he ended up providing for everybody in the state. And then they took, they had local, like within the state, regional trainings. So an in-person, kind of like train the trainer, but then an advocate went to each region around the state to train the technicians on how to use the NDCF. So again, they were the first state to adopt it statewide. They had already had experience with their own state digital check form. And again, I wish off the cuff I could remember in more detail, but they had an excellent presentation about all the different ways this data was informing their statewide child passenger safety program.
Yeah, and I think this isn't quite a direct answer to your question, but I think that some of it is also reactive too. During the presentation, I mentioned that we got some pushback about our initial misuse rates of saying these are too low. And we've gotten specific program coordinators from states or programs emailing us and saying, hey, I see this in my data and I don't think it's right. And then we go back to them and we say, no, when you look at your data, this is what you're actually seeing. So kind of getting in front of the fact that techs or program coordinators sometimes have a certain, vision in their head of what they're seeing or what they're looking at that doesn't always align with the hard data, and kind of getting that hard data in front of them.
Well, and I think misuse rates are an ongoing debate across the child passenger safety field. So like, what source do you use? And it's just ingrained in technicians, like 9 out of 10 car seats are used incorrectly. But if you really drill down and explore how that's being defined, technicians aren't consistent in how they're even marking off misuse right now. And so we have some learning to do in that consistency of information collected as well.
Well,
Okay,
we're
thank you.
right at time. So I want to just thank you all so much for the presentation. We will send the recording out to those who attended and it'll be posted on our Injury Center page as well for people who, if you want to share the link with others. Thank you all for the work you're doing. I feel like this is true research to practice, exactly the kind of work we like to highlight. So thank you again for taking the time, and thank you to everyone who joined us today. We hope to see you next month. Thanks.
Thank you for having us.